fanya aje nichukulie tu anything unaona ni poa Suzy. Ama whatever you are taking, but isikue rahisi. Aya, si mjamaa alikuwa hadi anatakanga kifuniko wa nyuma. Poa sana.
Iko na S7. The screen.
S7. Kilo ni 9,000.
Si 8.
9.
Sio kwa sasa 8.
Hebu kidogo simu yangu Suzy. Niseme S7, si ndio? Hello. S7 kio best price ngapi? Original. Sawa. Customer. Haki hizi teremuka. Original best ni 9. Ndani hiyo ni tunafaa. Hello. Poa sana. Juu ya nini ile ilikuwa? Oppo R15, yes. Nadhani nimereply. Kama uko Nairobi unatumana simu. Si basi tumia G4S. Lakini kama unataka kutumia basi yoyote tu hata cost basi ni inafanya tu bora upeane kwa ofisi. Na kutext tu saizi. Sawa sawa. Unaona aje?
Sasa yake. Alafu funga hii.
Hiyo inaweza fungua tutalipishwa. Button yake ifanye. Hii iko na fingerprint, sio? Ukireplace itafanya fingerprint. Ni phone gani? 7 Plus. 7 Plus. Ni hiyo unaweza replace but fingerprint itafanya. Kitu yoyote hapo ukireplace haifanyangi nini? Anything inatumika ku identify.
That makes no sense. I rented that apartment.
Ikafanya nini? Fingerprint ikakubali.
We shouldn't live
Basi hiyo ni
together.
kitu rare sana bwana.
It has a fireplace.
Ndio nakuambia.
Do you ever think about us?
Okay, but sisi Kenya tunajua mostly azifanyangi.
As a couple?
Tuiweke pia.
Sometimes.
I don't want that.
Kufanya na dhao mbili tu.
You don't want us to be a couple, or you don't want me thinking about us as a couple.
Neither.
Sawa.
If we get an apartment
Like
together,
kama 1
I
hour
feel like that's a signal that you and I might end up as boyfriend and girlfriend, and that's not going to happen.
You can't predict the future. Feelings change. I used to hate hugs, but now sometimes I don't.
But I don't want my feelings to change. I like being your friend, and romantic relationships are unpredictable. So much can go wrong, especially when I am involved. And if we live together, it's gonna be awkward. You're bound to walk in on me when I'm naked, or hear the weird sex sounds I make with some out-of-work drummer, or find me crying when the drummer dumps me, even though I was totally gonna dump him. I was so unhappy when we weren't getting along. You were too, right?
Yes.
Anything that puts our friendship at risk isn't worth it to me. Okay, Sean?
Yes.
Our gallbladder removal's off. Patient took an Ambien last night, woke up eating a roast chicken. Let's check the consult list for something a little more interesting.
See, gallbladders are boring.
You're a resident, you don't get to call any surgery boring.
See? This is
Hello.
interesting.
Hello? Hello?
Is the urine?
Yes, hello, unanisikia?
42-year-old female, cyclical episode of persistent loss of consciousness.
Yes.
PVT, rate of 180. We shot her back to normal sinus rhythm. Starting to feel.
No, it's in Kenya.
Swim back into PVT. We need to shock her. Get her into a bank.
That was cool. Maybe you just cracked your sternum.
You too? You're her husband?
Yes,
Your wife is pretty frail. Any idea what could have caused that?
she did. She's anorexic.
Kava ya nyuma ngozi yake inakaa ilikuwa imeanza kupeel sasa
This Dr. Parker,
Tapil
about your
zaidi.
urine. How long has it been fizzy?
I hadn't even noticed. Is that a problem?
kunawezeka mpya pia.
Symptom of several conditions.
Ya nyuma ni dhao.
You here for it though? Scope on you waiting? It's been sore. Been training for a race.
Joint pain plus
Hii Samsung walikuwa wameunda kama
you could
vibaya.
have
Zingine zitoka nangi rangi.
cystitis, bladder cancer, kidney
Well,
problem.
sounds serious. Should I call my husband? Emphysema cystitis is a treatable bladder infection.
Si
This could also be from
nini?
stone.
Ni kama simu itarudi saa mpya kabisa kwa uteka hizi vitu
Caused
zote.
by gastric bypass surgery. Depends. When was it? 15 years ago.
Sawa.
I used to be 377 pounds.
That's a lot. Your surgery wouldn't cause those symptoms, but we need to do a cystoscopy to find out what did.
I'll cancel paperwork though and get Lynn to sign off.
Hey, wait, what? So what is a cystoscopy?
It's like a knee scope, except the camera goes up your penis.
You administered amiodarone. Rhythm's normal.
That's good, right?
It's better than when you came in. Your heart is failing as a result of a condition called mitral regurgitation. One of your valves isn't closing all the way. Blood keeps leaking back into your atrium. That's why you fainted, and why we need to repair that valve ASAP.
How long have you been anorexic?
I've had issues with food on and off since I was 14.
Mitral valve issues are a frequent complication of long-term malnutrition.
This bout started about a year ago. Skipping meals, lying about eating,
exercising excessively. I don't know what else I can do. I can't monitor her 24 hours a day.
I'm not asking you to.
No, but you are starving yourself.
Mom. Grammy, come here. What's he doing here?
When I got home, I heard about the ambulance. I made Cindy bring me here. What's wrong with my mom?
She needs a surgery to repair a valve in her heart.
This heart thing, is that why she's so skinny?
Look, what matters, Graham, is that these doctors are going to help your mom. Okay?
You haven't moved your bowels.
Well, thank you, Sean, for that announcement. Saves me the trouble of tweeting.
The nurses already knew. They told me. They also said you're no longer talking to your dead daughter.
Constipated but no longer psychotic. A narrow win.
Your first defecation event is a vital part of the discharge criteria.
Event? What is this, the post-op decathlon? Pooping, peeing, walking, talking?
Yes, you have to walk a full lap of the floor, but you canceled physical therapy this morning.
Those nurses have big mouths. I canceled because my leg is a little sore.
That could be phlebitis or a DVT.
Could also
or
be an unsurprising complications from the surgeon poking around at my pons.
Every day in the hospital increases your risk of infection by 1.37%. You need to move your bowels and we should walk right now. We'll go very slow.
Sean, is there any chance that you are needed elsewhere right now?
I have 8 minutes until my patient's cystoscopy.
Good. Be early.
Urethra looks clean.
No lesions, no stones so far. How do we check for obstructions or stones further up?
Contrast cystogram.
Since you found this patient, how about you do the honors?
You know, this guy used to weigh 370 pounds.
Throw the catheter further into the bladder. That's a big drop. Good for him.
He did have gastric bypass.
That makes it less impressive. Now infuse the contrast.
Well, yeah, it is the easy way compared to just diet and exercise.
The contrast dye is dissipating.
It's supposed to. You said he's training for a race. Obviously, he turned his life around.
Still dissipating.
Bypass made it physically impossible for him to eat as much as he wanted.
It's gone. The contrast is gone.
Good. That makes no sense.
Where did it go?
He probably has a fistula, a tunnel connecting his bladder to his intestine.
Air and bacteria.
Glass kamenipata kama kako ndani. Nadhani imetoka.
Her liver and thyroid are normal, but her electrolytes are off. Her albumin is at 2.1. She's severely malnourished.
She'll be totally vulnerable to post-op infections.
She needs a surgery to survive, but she may be too sick to survive the surgery.
In order to operate safely, we need to boost her caloric intake, optimize protein.
Can't you do that through my IV?
It's more efficient to pump nutritional supplement directly into your stomach. We use a tube running down from your nose.
I had an NG tube once.
It didn't work. She couldn't tolerate it.
I guess it's not really about food. It's about control. You've lived for decades with a condition that has killed more people than any other psychiatric illness. You didn't just survive, you had a child.
Nabaka glass.
Can you tell us how?
When I got pregnant, it was like this terrifying miracle. I mean, the thought of gaining all that weight, but I wanted him so much. Both did. Every meal, I would sit with pictures of his ultrasound, imagining the food going directly to him.
Can you do that again? Eat for Graham? We've determined the fistula between your bladder and intestine was caused by Crohn's disease, an inflammatory intestinal condition.
Once we reverse your gastric bypass, you'll need...
Reverse my bypass? Are you sure?
Bypass surgery shortens the digestive tract. People with Crohn's disease need every inch of intestine they have, or they risk critical, even fatal malnutrition.
Okay, but I don't want my husband to know. And he'll be here soon.
Well, we would never reveal anything without your permission, but Crohn's disease is going to require some major adjustments.
I'll tell Spence about the Crohn's. And I'll tell him I'm having surgery on my bladder.
Your husband doesn't know you had gastric bypass?
That would require him knowing I was obese to begin with. That's not gonna happen.
Your husband must be very shallow.
Even if I don't disclose that I reversed your bypass, your scar's linked. It requires a separate incision.
Well, tell him there was a complication.
Our obligation to protect your privacy doesn't include lying. And you shouldn't have to go through this without
A
him.
single abdominal umbilical port. He can repair weak fistula and reverse his bypass all through a single incision. We can help deceive your husband.
Honey, I'm so sorry. It's okay, Smith. Got here as soon as I could. It's all right. And since my husband is surrounded by surgeons, what's the issue? What are you going to do about it? And how often have you done it successfully?
How are you doing? I'm fine.
Brad, would you mind filling this?
You've had 1 spoonful of tuna, 2 ounces of applesauce.
That's it? Mom, if that's all I had, you'd never let me up from the table.
This is different. I can't eat too quickly.
I don't believe you.
It's true. Your mother's suffering from severe malnutrition, and she's trying her best.
I knew it. You're too skinny. That's why you're here. That's probably why your heart's messed up and you still won't eat.
Graham, I'm trying.
How hard can it be to eat?
I'm not feeling well.
Me and Dad are really worried about you. Don't you care?
Of course I do, Graham. So much.
Then do something. Prove it. You provoked that argument?
Yep, and I may have just saved our patient. She requested an NG tube. Understanding is nice. Calories are better.
He's screwing this up. His husband's scared and he just wants to know what's going on.
Like marital advice from the divorced.
You're divorced too?
And I'm not advising. I'm not judging the health of a marriage based on a single secret, which is neither shocking nor a sign of its imminent demise.
The truth in a marriage is overrated?
It wasn't mine. Not every single insight, opinion, or impulse needs to be shared.
Marriage sounds confusing. No wonder you both failed at it.
How's it going in here?
Not as bad as I remember.
Does it hurt, Mom?
No, just a little awkward. Makes it hard to talk. But I'm okay.
I am so proud of you.
Dr. Glassman hasn't defecated or done his physical therapy.
I am aware, and yet unalarmed. Who are you?
I'm Dr. Sean Murphy.
Oh, right. You're Dr. Glassman's friend.
Please order him to do physical therapy and give him 15 milligrams of X-Lax.
The X-Lax is a decent idea. As for the physical therapy, of course, he's stalling. Glassman's a proud man. He ran this hospital. He's reluctant to feel weak and vulnerable in front of people who used to work for him.
That doesn't make sense. He is weak. He just had brain surgery.
Well, sensible or not, that's my take. He'll walk eventually.
Every day in the hospital increases his risk of infection by 1.3.
You tell him that, and maybe I'll hop right out of bed.
I did it. Didn't work.
You didn't respond to the stick. Try the carrot. Although really, I would just advise.
Dr. Glassman doesn't like carrots. What should I do with the stick?
It's a metaphor. Glassman appropriately is the donkey. The stick signifies punishment. The carrot signifies reward, but he's recovering nicely, and your best bet is to just be patient with him.
So I should use a reward to motivate Dr. Glassman to do physical therapy?
Actually, what I'm saying is that you should be patient and supportive. And please, please answer that.
Ya simu gani?
Close the door.
We were headed to pre-op when we started projectile vomiting.
Green. That could mean bile and a partial bowel obstruction. We need an NG tube.
Obstruction?
Crohn's caused that?
Hey, saí.
It's hard to know for sure. NG tube's that.
You're doing great. You should try and get some sleep.
Can't. There's this voice in my head and it won't be quiet. It keeps telling me that this bag has 60 grams of protein, 40 grams of fat, 1,200 calories in total. It just won't stop.
Try to think of Graham and Stan.
I'm trying.
I'll get something to put over them. No! I can't stand it.
I got your deposit back.
Why?
Sean, I told you that you and I can't live together.
No. You told me we can't be boyfriend and girlfriend. We can still be friends with benefits. The benefit is we would be living together.
I was clear. It's too
You
complicated.
were. We can't date or kiss or have sex. But I thought you wanted to be friends
Yes, of
and
course.
spend time together.
Right.
Then it's simple.
She begged us to reinsert the NG tubes and pulled it out again an hour later.
Do we try again with a tube and restraints?
We'd just be raising her risk of self-injury, pneumonia, blood clot.
About going back to solid food.
Anything less than 1,200 calories a day, and her malnutrition wouldn't be improving. In fact, she'll keep losing weight. We should go ahead with that bowel repair now.
I think we can improve her nutrition without force feeding or IVs. I found a small study. Her deep brain stimulation was used to treat anorexia.
You want to use brain surgery for a psychiatric disorder.
Surgical procedures have been effective for depression, OCD, addiction. This surgery could reduce her anxiety around eating. Once she's eating, her malnutrition will improve and reduce the risk of valve repair.
It could also cause personality changes. And this study covers 6 subjects with only 50% success.
This could be Louise's only shot at getting free of this illness.
And it was done in the UK. EBS is an FDA approved for anorexia treatment here.
So you call an IRB ethics hearing and argue emergent use approval.
Which we shouldn't get off such little data. Nice work digging this out. It's not a real option. Let's go talk to her about the valve surgery.
Can help you?
I'm looking for a carrot.
No, sorry, we don't have any carrot muffins. How about the lemon poppy, Sean?
Hello, Debbie Wexler. It's a metaphor for moving a donkey. I need a carrot because I don't want to beat Dr. Glassman with a stick. He likes blueberry muffins.
How's Dr. Glassman recovering?
He moved his bowels this morning. He doesn't want to appear weak, so he hasn't done physical therapy. And I want that blueberry muffin, please. It has 23 visible blueberries.
You know, Aaron once told me that his absolute favorites were the chocolate chip ones. Do you want one of those instead?
Yes, I want one of those instead.
Oh, hi, Dr. Park. I have a few questions about Wade's surgery.
Sorry, I'm pretty busy. Actually, I need to get going.
I'll walk with you. I know Wade's surgery is this afternoon, but I've been researching treatments for Crohn's lesions.
We knew before the internet.
I talked to 2 experts who felt that Wade should be put on Remicade or azathioprine before any surgical interventions.
Interesting recommendations, but considering they haven't seen your husband's chart,
Well, this doctor felt strongly that you should see how he responds to medication.
Wade's care is completely appropriate for his condition.
But if his Crohn's lesions could be treated without cutting
That's
them
not
open...
what we're treating.
Excuse me?
Go talk to your husband.
I brought you a chocolate chip muffin.
I love chocolate chip. Thank you.
Hi.
Where is it?
At the nurse's station. You can walk out to get it.
Well, you see, here I thought you were doing something nice for me.
I am.
No, you're not. You're manipulating. My leg hurts, and I have a sore throat, and I don't feel like walking.
Dr. Blaze says you don't want to seem weak in front of people who used to work for you.
Dr. Blaze is wrong. I don't want to walk because I don't want to walk. And this is condescending, and it's insulting, and it's annoying.
Should I get you your muffin?
Well, that would be nice.
The orderly is eating it.
Mr. DeLeon, can I help you?
My wife's decided against the valve repair surgery. At least until she's tried the deep brain stimulation for her anorexia.
Did Dr. Brown tell you that it's an experimental brain surgery which could alter your wife's personality forever? That's if we get the special approval required.
She's explained all the issues.
I got our apartment back. I had to pay $300 more as a deposit because someone else wanted it, but that's okay because it has a fireplace.
Aren't you listening to me?
Not listening to me. I'll be okay running into you naked. Or hearing sex noises or seeing you cry over breakups with drummers.
I know that you think you can, but how can you be sure?
Because living with you will be good for me. It makes me happy.
You remember what you said, Sean? That no one can predict the future and feelings can change. What if I end up hurting you again? I don't want to risk our friendship over an apartment. Do you?
If we don't live together, you will have to buy your own batteries.
We'll still see each other.
That will be hard. I work a lot.
We'll find a way. I know we will.
I need to go to work. I'll stop on the way home and tell the manager we don't want the apartment.
No, do it.
The subjects who responded in this study are all long-term sufferers with a target BMI of 13 to 16 who actively pursued this treatment, much like our patient. Additionally, DBS surgery requires lighter sedation and places less strain on her system than an open chest procedure.
You're referring to the valve repair recommended by Dr. Melendez?
Yes. I propose delaying that surgery by a couple weeks, which would be well worth it in terms of reduction of risk if the DBS is successful.
Excellent presentation, Dr. Brown. Very thorough.
Agreed. Though I do have concerns about approving this procedure based on the small subject pool, but I'll confer with...
There is one more person I want you to hear from. The patient.
This is an IRB, not a therapy session.
Actually, patients who have the opportunity to air their concerns are 8 times less likely to sue their hospital.
Excuse me?
You can step out. Dr. Park's got this. Grab the sheet. You talked to Wade's husband.
Maybe we should discuss this later.
Patch him up while tearing you down. You violated our patient's confidentiality.
I told them what we weren't treating was not a violation, and their marriage is better off for having his secrets out in the open.
That'd be meaningful if you were a marriage counselor instead of a surgical resident. Whatever lie blew up your marriage won't be undone if Wade tells the truth.
I was just trying to help our patient.
Our former patient. Wade's demanding a transfer to another hospital.
I have tried cognitive behavioral therapy, food psychodynamic therapy, family therapy, inpatient treatment, outpatient treatment, antidepressants, NG tubes, TPN. And yet here I am, dying. Killing myself. And I can't stop on my own. Please, help me to stop.
Are you aware DBS has been known to cause personality changes? In your case, the electrode would be at the nucleus accumbens.
Dr. Brown explained all of the risks.
It's important we know that you understand. The nucleus accumbens plays a role in maternal attachment, delivering dopamine when moms interact with their children. Now, what if in trying to overcome your eating disorder, you lose the ability to feel love for your son?
My son is everything to me. For the past year, he's been watching me starve myself to death. I'll risk anything to keep him from seeing me succeed.
Ile Samsung. Sasa mimi nimejaribu kila kitu. Yenye hatujajaribu. What we have not tried ni hiyo ya kuifanyia sasa kuifungua.
You kept it a secret because you think I'm shallow.
I know.
I kept it a secret because of friendly fatties. Any news on my transfer?
Sasa
General should have a bet tomorrow.
options ndizo ni chache.
Chill, clamp your nasogastric
You're talking about a couple we've known for years? We were at their wedding.
Hiyo izienda lower than inafaa kuwa 22. 22,000.
The point is that's why.
Red and green makes brown. Your bowel is bleeding. You need surgery now. Page Dr. Park and Dr. Lim. He has a strangulating bowel.
It's gonna be okay.
He's not up in the floor now.
By margin of 2-1, this internal review board has decided favor.
Nicely done.
Alafu sasa
Hope the surgery goes well.
sasa masimu zako pia ni za nguvu.
Si ati za nguvu ni njaa.
So vitu zao zinaingia na bei.
Na unaona nataka pia hii sijui hii tutaifanya nini?
Use the 45mm gold stapler. The truth coming out didn't help Wade's marriage.
Hopefully with some time, secrets are corrosive. Wade should have been honest from the start.
Maybe Wade thought Spencer would feel the same way you did about his bypass. That he lost weight the easy way.
Gani hiyo? Ya juu si unaweka tu ingine tena.
Okay.
Tuanze na hiyo note.
It's time.
Hii ni note ile si wachana nayo hata siwezi hiyo mbele. Hata ile ni kioo.
Gani hiyo?
Ile.
Hii si kioo tayari kwa kitu unaweza fanya.
16K.
Notes.
Hiyo ni correct. Bila hata sita. Na hiyo simu na broke mtu na hata ni unaona fare ya kukuja tao.
You are
Sasa mimi nilikuambia
Afiki.
unafanya biashara.
Afiki.
Afiki. Nilichokuambia tu bei hiyo unajua ni yangu. Nasema mimi nilikwambia bei. Unajua hiyo ni bei yangu sasa.
any person on the planet
Nikaambia hadi kitu kama hivyo after the repair.
Achana na hizo vitu kwanza tusikie. Hata niende nikuje.
Sasa
You're gonna be okay, right?
22.
Of course, baby.
20. Man, unasikia mtu anataka simu wewe kwa 20,000.
Sasa yeye ndio maneno yake amelipwa. Watu siku hizo tu unalipanga mapema.
Hata mimi na simu zenye nimeleta hapo.
The chocolate chip muffin didn't work. The donkey won't walk.
I told you that Glassman's probably embarrassed.
No, he's not. I asked him, and he said you were wrong.
Doesn't mean I'm actually wrong.
Ndio niulize.
He needs help recovering. I'm trying to help, but it's not working. He got angry at me. Dr. Glassman is your patient. You need to fix his lack of mobility. I don't know what to do. I don't know how to help him.
Being sick is hard. Being around sick people is hard. We want to help. We all struggle with what to do. Your obsession.
Okay.
More than a muffin or a bowel movement
Uko
or
wapi?
a walk around the ward. What
Hebu fanyaje?
is someone to be
Niulizie note 9 hapo best kabisa ni ngapi note 9?
patient, supportive friend.
I know the perfect person.
Ati? Siske? Sawa. Ati kwa nyumba. Ya nyumba ndio nilibeba nikaleta huko. Huko ndio na spend time anyway.
Hizi simu niko sure hata ukitengeneza itahamu.
Simu yangu itarudi poa.
Wewe niko hapa.
Sawa. Sawa.
Sawa, na kama.
Na 21.
Wacha hizo. Kwanza niwekee kioo.
Tatafutanga hiyo dawa ya jua.
Wacha nitatafuta sotano juu ya kioo.
Sawa.
Sawa.
Ati niweke protector. Protector hii ni 1500 bana. Serious.
So wacha basi nitoa 21 niende nayo.
Sawa.
Na kama
after 40 minutes ama 1 hour ikienda sana.
Sawa, na kama.
Haya.
You want to pattern?
pattern nahitaji pattern. Ni mzuri tusiende kwa unlock alafu realize kuna kitu iko onekana. Hello.
I wonder if that hug felt different for him. Did it for you?
Ati?
Your husband's surgery went well. He's in recovery now. I think he's awake. Thank you.
Mmeka vizuri kabisa.
Wait, tell me where to find these. This is him before bypass?
He said that seeing these would help me understand why he never told me. Which I said was ridiculous.
Acha niandike namba just in case. 07.
So you're gonna end up like this again? It's possible.
Battery S8. S8 hizo battery zote inbuilt ni down mbili. Unless ni iPhone. Hello. Yes. Bana. Hata ndio Suzi. Suzi kuongea na customer. Dakika moja tu. Simu imeenda wapi hiyo Sony?
Yeah.
Sean thought you could use a visit.
Huh.
Oh, and another muffin.
Thank you. I wish I'd known you were coming. I would have slipped into something a little less comfortable.
You look good.
Huh?
Oh, well.
Unlikely, but thank you.
I am sorry that I've been in touch.
Well, I had a brain tumor. Understandable, we both dropped the ball.
Here we go.
What's happening?
We're taking a walk.
Oh, no, thank you. No, my leg hurts.
Which is exactly why you need to take a walk.
Wow. You're really good at this. You sure you haven't done this before?
Well, I spent a little time as a nurse. I always like the night shift. Everything gets really quiet. It's almost peaceful.
Kama anapinga anasema ngapi? Naweza kuwa nilimpea discount na sikumbuki.
She's here.
Great news.
Hopefully we'll be able to do the valve repair in a couple weeks.
She won't be able to do the surgery.
Hey, mambo.
Or any surgeries.
Sorry, nilishikana kidogo ndio nika transfer.
I had a good idea that you didn't take seriously.
I considered it.
Decided
against taking it to a patient.
I mean, I managed to get Aoki and Andrew to sign up for the IRB.
Nakumbuka kweli tulikuwa tumesema okay, toto yake inafaa kuwa 6.
You voted for me.
Nilikuwa nakupea nini nilikuwa gada.
Disagree with me all you want.
Sawa, basi itakuwa 55.
I expect them to argue passionately for their position.
Hapo lakini nitakuwa nimeumia for real. Sijui kama nilisema hivyo but nimeangalia venye nimeichukua leo. Nitakuwa nimeingia mfukoni.
I can't run my team any other way.
Transini hiyo mpaka wapi ilikuwa? Naivasha, Narok. Narok ni mine. Hapo ni noma haki.
You know what was insane was the 1928 torpedo roadster.
With the Purple Heart trim.
Lizard skin interior.
Acha ulipe transport. Nasema ikue basi 5 utalipia transport.
Debbie Wexler did it. She's a better carrot than I am.
Hapo ni sawa.
She's a better friend.
Nasema nitakufanyia 5,000 wewe utalipia fare.
Hey, that's me.
Yeah,
just making sure the check out there, okay?
Sawa.
Great.
Wait till namba yetu alafu wafikisha Chifois atakwambia kilia huko.
I know he's long gone.
Azina kisika Chifois atakwambia pesa unalipa kwa atili ya Chifois.
What do you think would have happened if I hadn't seen you two together?
Haya. Umeshasongia simu tu.
Found my next apartment.
Okay.
It has a fireplace and natural lighting.
No.
And a really great roommate who's also a friend. He works a lot, so it might be hard to see him otherwise. I'm talking about Aisha. I don't want to risk anything hurting our friendship. If you say you can handle living together, I trust you.
We're going to be roommates. It has a fireplace. It does. Oh, we're going to be roommates.
We're gonna be roommates.
Okay. Oh yeah.
Lazima ukifanya moja tu kutakuwa sawa. Unaweza mix vitu hapa. Kuna vitu unaweka balance yake. Kwa maana ya 50 na nini? Na S7. Hello.
Morning, Ruby.
Morning, Ruby.
I'm going to the market later. We need more apples.
No, but we need more toilet paper.
No problem.
Bla Vision. Simia kulikuonyesha Bla
No
Vision mali.
problem. Angel Fluff plus 2-ply unscented ultra-wide extra soft.
Sawa. Piga kwanza.
Why?
Siwiki kwa kujie 50.
You have to hang the toilet paper on the dispenser the correct way. The paper goes over on the top, not under, hanging against the wall.
Sorry, everybody like it like that.
I don't like it like that. It's right like that.
Ukiangalia unaona uzilipe password afungua nini.
I gotta run.
Haina password sawa. Sijaribu kuweka ile safe mode. Jaribu kuwasha. Kama nione nini.
Hi, I'm Dr. Melendez.
Sorry, I have to practice whenever I can.
I practice whenever I can too.
We heard you hurt your finger. Can we take a look?
I got a crappy manicure a couple days ago. Now my nail looks disgusting. Paronychia. It's an abscess caused by a common bacterial infection.
We'll drain it, pack it, and send you home. In 72 hours, the pain and swelling will be much better, and you'll be back to Paganini.
Apologize already.
Did nothing wrong.
So, you want to be iced out by the future chief of surgery forever?
Lynn can be chief too. Anders hasn't decided yet.
Keep around. Park, hustle in. EMTs are less than a minute out. Park, make sure Bay 3's ready to go.
13-year-old female, progressively worsening epistaxis. Bolus on the bus, BP 86 or 51.
It won't stop. I can't get it to stop.
I got home and she was calling 911.
Not your first medicine, huh, Dad?
Well, these things usually go away on their own, but Riley claims it's been like this for over an hour.
Oh, it's not a claim. It's a fact. You need to get her on a monitor right away and apply 4% phenylephrine solution. We need to cauterize the bleed. It's not my first nosebleed either.
I have my premiere at Davies this weekend. Hence the manicure. Rosin, beeswax, that stuff is tough to get off. You play? I know my way around most things. I dabbled in archery when I was in high school. I started when I was 5. I used to hum melodies, doing my homework, eating dinner, taking out the trash.
I wanted to be a train conductor.
There's still time.
She's numbed up. She shouldn't have any pain in her finger.
It's not my finger, it's further up by my knuckle.
Any body aches?
A little. Playing violin all day stresses out my shoulders. It's likely tendinitis or mild arthritis.
More likely flesh-eating bacteria, and we may have to cut off your finger.
Use the bleeder, the posterior ramiocussovax plexus.
Alright.
You called 911?
She did.
How you feeling, baby?
Peachy.
It's a nosebleed. I'm handling it.
She's my kid too, Bruce.
Bet you couldn't tell they're divorced.
Well, why don't I take Riley's parents to the waiting room so we can...
Talk about me. Adios.
We need to know.
Sean, what do we need to do to know for sure?
We need to cut deeper and get a swab.
Fingers have thousands of nerve endings. Clipping off even the tiniest portion of Jazz's finger could cause permanent damage and be career-ending.
But if it is necrotizing fasciitis and we do nothing, she could die. That would also end her career.
True. The number, Sean. The data. There's almost no chance that it's knife fash. On the other hand, if we test for it, we will definitely do damage. Anything else?
Do you hang your toilet paper going over or under?
Doesn't matter.
Before the nosebleeds, it was tummy aches, insomnia, breathing pain.
Every time we'd rush her to the pediatrician, but they couldn't find anything. So we stopped taking her.
You think she's faking it?
A therapist said it was...
Hapana, hiyo ni kioo hapo nimeona vile inaonyesha hiyo ni screen. Jaribu place ingine.
Which isn't easy for adults. Why should kids be able to deal with it any better?
She disengaged. Not just from us, but her friends, school. It's been 5 years. She should have found her new normal by now.
Looks like someone's doing better.
Nosebleed stopped. Riley's nasal membranes are pretty thin. You should be on the lookout for future bleeds.
Riley, have you been sniffing or snorting any drugs lately?
What? No way I wouldn't do that.
And there's a lot of stuff out there that looks harmless, but...
She said no. Does Flonase count? I was coughing. I had a stuffy nose, itchy throat. I looked up my symptoms because what the hell else was I supposed to do? Vasomotor rhinitis fit. So I went to the drugstore and I got some Flonase.
Misuse of steroid sprays can thin out nasal membranes, causing terrible nosebleeds. Quit the Flonase, you're good to go.
Thank you.
I need you to take her tonight. I had to skip a pitch to an important PC to get here.
Sorry, didn't mean to take you away from anything important.
You're provoking her. I know she's anxious.
I'm not anxious, I'm sick. People are something like that. This is your fault. She's blaming us against each other. What's wrong? My breathing, it hurts. Just relax, sweetie. Just stop, both of you. Vasomotor rhinitis. That is a pretty unique diagnosis for an 8th grader. It'll be numb in a minute. 7. And I was wrong. Doesn't matter. I get where you're going through. You were smart. Popular. We don't have anything in common. I was never popular. I wore hand-me-downs from Goodwill. I never knew my dad. My mom was sick. I couldn't rely on her. Kids that age can be total jerks. Asshats. Turds. I wouldn't send my worst enemy back to junior high. I got so many D's on my report card last year, I got held back. Now everyone treats me like I'm stupid. It's humiliating. How do you deal with it? I said, screw it. They already think I'm bad. I mess around in class, leave campus, do whatever the hell I want. But you're still angry. I didn't let my past define me. And yours doesn't have to define you. Repeating a grade doesn't make you. What? What's wrong? Nothing. Doesn't seem to be any active bleeding. But I coughed up blood. That was real. It's possible it's just post-nasal aspiration. That the blood you coughed up was from the initial nosebleed and it went down your throat into your lungs. My chest, it really hurts.
You forgot to put your coffee cup in the dishwasher before you left.
Sorry, I was in a rush.
And remember, rinse it out before you put it in the dishwasher.
Noted.
And on the top rack.
I gotta go.
Me too. Morgan doesn't want to know what's wrong with our patient.
I find that hard to believe.
They talk about bowstrings. I don't know anything about bowstrings. They should be talking about what's wrong with her.
Can't always know, Sean. Sometimes tests aren't worth it. Sometimes we don't have the right tests. What are you doing in here?
Leah and I disagree about toilet paper, and you made a good point about finding the right test. I just did a test.
On the toilet paper?
Every toilet paper roll in this restroom has the paper hanging over, not under, and they were installed by professionals.
Does it matter?
IDGA. I think it's an acronym, or maybe even an anagram.
I don't think Leah cares about the toilet paper debate.
It's not a debate. I'm right.
I think you should talk to Leah, not text. Talk.
Did you talk to Dr. Melendez after you got in trouble with him?
No.
Why not?
Because I did nothing wrong.
Because you were right.
Yeah.
So am I.
Make sure all 4 tips are touching the ground before you take a step.
Well, thank you, Iris. I'm going to figure that out.
I'm required to show you how to use all medical equipment.
Well, I'm not going to use it. And you want to know why? Because I'm not going to use it.
You remind me of my grandpa Eddie. So grumpy, so adorable.
See? Look, no hands. I'm fine.
Chicken soup. Heard it's good for the soul.
I wasn't expecting you. Thank you. That's very thoughtful.
It's no big deal. I had signed up to bring you food at the hospital on the meal train that they set up.
The meal train, yeah.
Yeah. How are you doing today?
Well, today is actually looking up. You want to come in and have some soup?
I have other plans. But, I'm actually free tomorrow. Do you like lasagna?
Kind of love lasagna.
Great. Finally get that second date.
You know, you don't have to.
No, Aaron. I want to.
Well, then I want to.
Okay. Great. Then, I'll see you then tomorrow.
I'll see you tomorrow.
No double
is in archery unless they're at
Hello.
summer camp. How long did you do it? 7 days a week for 7 years. Why'd you stop? It was just time.
Con ile
To go to college, medical school,
Haya.
be a grown-up.
Hiyo yenye nalipia ni gani?
It's not easy to just quit. Archery doesn't fill concert halls or pay the bills.
She has a slight fever. Her rash is spreading and she has edema. This is definitely not paronychia.
I know. I've moved on to MRSA.
That's possible, but you should want proof. If we do an open, deep tissue biopsy, we will know for sure if you have flesh eating.
Sean. Part of being a good doctor is knowing when to not scare the crap out of a patient.
I don't think so.
This is your problem, not hers. Your need to be sure, your obsession.
We need to cut off a small piece of her finger so we know if we have to cut off a larger.
Sean, you're acting like you want to amputate her hand.
No, you're acting like you don't want to amputate her hand.
I don't.
That's not medically relevant. Her temperature is 102. It's gone up 2 degrees since we've been arguing.
Okay. We'll test her.
That tissue has begun to die.
Or it's inflammatory infiltration.
Find anything?
We're on an impasse.
Look here at the margin. Subcutaneous fat and fascial necrosis. Sean was right. Let's go try to save her hand.
She is a young girl with a lot going on.
Well, we agree on that much. That's why she needs to see a shrink.
This feels different. Oh, you don't believe in emotional intelligence?
If I have to choose between the battery test we've done and your gut, it's an easy choice.
You don't relate to her, and if you don't relate to her, you can't understand her.
You're probably right.
You think you do relate? Or do you have a kid?
My opinion about Riley is medical.
Why haven't you told any of us you have a kid? That is a huge chunk of your life you've been hiding.
I don't feel the need to share everything about my personal life with the people I work with.
That's your passive-aggressive way of saying I'm an oversharer?
Yeah.
Your opinion on Riley is clearly skewed because you're looking at her through a parental lens. I've been in her shoes. I am better equipped to evaluate her situation.
You're the poster child of skewed. You're too emotionally involved and are overreacting because you had a crappy mom who didn't care about you. And why do I know all that? Because you're an oversharer.
What scan's clean?
This Turner syndrome?
Clamp. Whoa. That is not good. Muscle's weak, clamp slid right through the fascia. Or if you pull the skin back.
Smells like rotten eggs.
There's only tissue damage. If we debride her hand carefully, we can preserve some mobility and dexterity.
He's gonna need close monitoring post-op tonight. Scissors.
We need to talk.
Can it wait? I'm late for an all-night coding session.
You hung the toilet paper incorrectly.
Right. Did you flip it? Great. We're done.
He left the TV remote on the couch.
Sean, I'm running late.
You have to put it on the tray, on the coffee table. That is where it belongs. If it doesn't have a set place, then it will be in many places, and then it will get lost. And if I can't find it, I can't watch the Weather Channel.
Enough about the damn remote! Everything in this place has to be your way. We have to make sure to use 2 pods in the washing machine. We have to keep the cups to the left of the plate. We have to keep the air conditioner at exactly 74, and we have to use one very specific, very hard to find toilet paper, and I'm trying to be accommodating, but you are not cutting me any slack. Oh God. Sean, I'm sorry. Are you okay?
You have a ruptured Achilles. I'm afraid your weekend party is over.
Get some help here. Right there.
What happened?
She couldn't sleep. She suspected fever. It's only getting worse.
I can't breathe.
Take a deep breath. In, out. 104.6. And the IV acetaminophen cooling blankets ASAP.
She's tachypnic with an O2 sat of 87. Is this something new, or did she do this to herself?
Has an infection. I think
Suzy,
she's developed pneumonia due to
ambia watu wa Sony
What underlying condition?
I have no idea.
kama hapo traveling wale wenye litumananga mwambiange mapema hata kana malizia.
No signs of PE.
Ili kama nimetest iko sawa. Funga.
I think we may have missed something on her CT. There. That slight shadow on the bronchus. A slow-growing carcinoid tumor could cause chronic airway inflammation. As the tumor grows, symptoms worsen, leading to airway obstruction and infection.
Or it's just a shadow, a slight shadow.
It is pretty subtle.
I would like to do exploratory VATS.
You want to poke holes in her chest and go rooting around in her lungs?
Riley's body's already compromised. There are no obvious lesions, and her symptoms are more likely indicators of a simple sinus infection. The safer, better plan is to treat with antibiotics.
If she has a progressing tumor, we can't just send her home with medication.
Pitch the surgery to the parents and Riley.
Natamanisha hata screen kufunga tu. Iko sawa.
Well, I'm just moving your toys over so it's easier to get to your medication.
Toys? Toys? Those are not toys.
Amen.
It's Reggie Jackson.
Well, when that timer goes off, Roger Johnson can give you medicine.
Reggie Jackson. Hey, guess what? Quitting time.
Okay, have fun. Take your pills.
I think it broke Sean.
Hi.
We got into a big fight, huge, and I was yelling, and he just fell apart. It was awful. And he pushes and pushes and pushes. I pushed back.
Well, Sean's not easy, but you knew that.
I knew it was going to be hard, but living with him is a lot.
I know.
There's stuff I've never even thought about, and I know he has idiosyncrasies, but there's a lot of them. I mean, a lot.
I know. Is Sean okay?
Yes. No, I don't know. He's at work. Lassie. You know him. Like, really know him. How do I deal with Sean?
Well, it's been 12 years and I'm still learning.
He just always has to be right. I mean, do you know how many calls and texts and notes he's left me about how I'm doing stuff wrong?
You have a pretty good idea, you.
Yeah, well, it's exhausting.
You know what? We all have quirks. We can all be a pain in the ass from time to time. Okay, admittedly, Sean a little more so.
He's not helpful.
Sit down.
What?
Sit down.
Why?
Why? Because you're agitated and you're annoying me, and I can't give you good advice in that state. Sit. Thank you. Do you like Sean?
Of course.
Why?
He's sweet, kind, honest, sometimes brutally honest. There's never an agenda with him. He's just Sean.
So?
So I want him to change. A little.
You moved in expecting him to change. He doesn't want you to change. I know that.
And And if I made the wrong decision?
Then you move out and you do it right now. It'll devastate him, but the longer you wait, the worse it will be for him.
If Riley has a tumor, we need to open her up to find out what we're dealing with.
Why do you think she has a tumor?
It's consistent with her symptoms.
The same symptoms she's been having for years?
Yes.
The same symptoms we've been told are psychological. The same symptoms a dozen doctors have run 100 tests for and found nothing.
There is a shadow on her CT image.
A shadow?
And it's risky surgery.
Opening her up in a weakened state could be dangerous.
I know Riley frustrates you, drives you crazy. But I also know you love her. You have a chance to show her that.
So you want to do this as a statement?
We want you to believe in your daughter. Because that's what a parent does.
When she was little and had a bad dream, she used to come into our room and snuggle up under your arm. Just like she's doing to me. He would stroke her face until she was finally at peace and fell asleep. She's in so much pain. And I don't know how to make it go away.
Really? Hey, the doctors, they want to see what's going on in your lungs. They think you might have a tumor. And we want them to operate.
You think I have a real tumor?
It's scary, I know. But, yes, we do.
BP's dropping out. 73 over 4.
I just spiking to 137.
Hanging, I need saline bullets.
I need a 12 lead. Process has migrated. She's septic.
There's definite infiltration in the lung. We're gonna have to amputate her arm.
Cosa?
Polish the bond helps them here.
Lipa na M-Pesa, buy goods.
The margins appear to be clean.
There's still a small chance microbes may have spread to her organs.
If they did, then her mortality rate just increased exponentially.
What if we put her in hyperbaric oxygen therapy now? Oxygen's toxic to bacteria.
There's a lot of things that could go wrong in there. We wouldn't be able to decompress the chamber in time to help her.
We wouldn't have to wait to help her if someone goes in with her.
I'll do it.
Okay. Get the chamber ready.
Lung tissue looks normal.
And they're healthy appearing bronchi. Nothing. Yeah.
Damn it, tore a lobar artery.
BP's 81 over 49. Oxygen sats 93. Heart rate is going up. She is tanking.
Heart may need more suction. I can't see a thing in here. We need to do an open thoracotomy now. Brown cracker chest. Template in your rib spreader.
There are only 7.18 cubic meters in here. How does it feel?
It's fine.
I thought it might feel claustrophobic for someone neurotypical.
A50.
Got it. Still bleeding.
Stroke volume just bottomed out.
Rapid infuse 4 liters of whole blood. Ready to start cardiac massage.
Wait, I think I have an anchoring arterial wall.
Stroke volume is rising. BP increasing 90/60. Pulse is 90 irregular. She's stable for now.
Tunashukuru, karibu tena.
This was a mistake. We need to close up as soon as possible.
Ati? Ukipata pia ameharibu watume hapa tutashukuru.
Something else is supposed to come out.
Karibu sana.
What's going on in here? Ron, I need my light. Yeah, see that?
A localized granuloma in the right lower lobe.
You think it's cancer?
Not sure, but something's in there. Parker, try the lung. It's a Lego. Riley must have inhaled it years ago.
It settled in your lung, became encased in an inflammatory tissue. Your body's immune response attacked it, making you progressively more sick over the years.
Hata hiyo ingine ni noma.
Small, thin, and made of plastic.
Frame.
There was no way of seeing it underneath the imaging.
Ugh, this is so gross. I'm gonna make it into a necklace.
Ako wapi?
Good luck. Excuse me.
We're sorry that we didn't believe in you. We're sorry that we put you through all of this. We're sorry that we got divorced.
Whoa. You guys are way more apart.
We always thought you were upset because we split up.
I was upset because you fought all the time. I still do. It freaked me out. So I'd hide in my princess tent, bite my nails, gnaw on crayons, chew on Legos.
We screwed up. And we promise we can do better.
I am not saying that Ordinary People is not a good movie.
It's a great movie.
It's great. Okay, what I'm saying is that Raging Bull is a superior cinematic experience. It is raw. It's like romantic.
It's romantic.
Yeah.
It moves you from start to finish.
Exactly. Exactly. Like adrenaline's pulsing through the veins. It gives me breathless every time I watch it.
Do you wanna like go for a walk?
It's a little cold outside. You are? Okay.
I'm just gonna give you a walk upstairs.
Okay.
This way.
Whoa. Hi. No, thank you. Look at that. I'm okay. I'm okay. I'm okay. Ow.
Is my hand okay?
Your biopsy was positive for necrotizing fasciitis. We had to do multiple surgeries to remove the infected muscle and bone.
Bone?
I'm so sorry, Jazz. We had to amputate your arm.
No. No, my arm still hurts. I can feel it still there.
Phantom pain.
What you're experiencing is phantom pain. Your arm is gone.
By this, Susie.
Well done.
Sipa quickly faipeleke kama
Finally, a believer in the power of emotional intelligence.
kama me volunteer.
Get her parents on board, even if it's only for a little while.
They believe their kid and they're working on their family relationships. It's pretty big steps.
It was a nice moment. But if you think you changed them, that they'll be different people tomorrow than they were yesterday, then you're kidding yourself.
Right now, my emotional intelligence is telling me even you don't believe that.
Kitchen's clean. Leftovers are in the fridge. How you doing?
Fine. Just got a little lightheaded. Balance isn't quite back to normal.